Hi, it's Claire, and this is going to be my shift report assignment. I used template number 2 this time that looks like this. And the first time I used template 1 and 3, which were a little similar but have some differences. So we'll just say Madeline, a 9-year-old female in OR1. She's here today for a tonsillectomy. And the attending is Porterfield and Reed. Consults are anesthesiology, pre-op consult, and then physician consult or surgery consent, and then also allergies and education went over, no known allergies. She has no prior medical history that's significant. An indication for tonsillectomy, though, however, was needed after some complications from that. We currently got IV access in her left dorsal hand IV. Her fluids are lactated Rainers. Activity and diet has also been educated for her, including after this, so we gave the parent the education. No strenuous activities post-op and maintain rest. Diet post-surgery, we have her on liquids, and then soft foods for 1 month moving forward is tolerated. Neuro was within normal limits. We neuro status check for consciousness during the anesthesia was appropriate. She did have a little bit of anxiety, crying and yelling, so to expect that post-op as well. Respiratory rate was 26 during the intra-op period monitoring. A CBC was not available to view due to the new Epic system. Cardiac was within normal limits. GI was within normal limits. GU and skin was all within normal limits. Please note that Tylenol rectal suppository was also given. In pain, the patient did not verbalize pain score. However, they were very upset, anticipating the surgery with that anxiety and crying. So fentanyl was given by anesthesia. Medications overview. She did receive fentanyl, the Tylenol suppository, lactated Rainers, propofol, and nitrous oxide gas for induction. Test cultures were labeled and sent to lab from the tissues of both the tonsils, the left and right that we removed, in full immediately done during procedure, and then these were sent after procedure. Informed consent was signed and airway patency was tested. Intubation was successful for this client. No fall risk. VTE prevention, no, due to the age 9. So there were no SCDs applied during this surgery. And post-op care, we are including to educate for voice rest, liquid diets, and physical resting as well. So looking at this template, there were a few changes that I was hoping to just make with this. I noticed that there was not a section for medications, which I found very important. So I did just add the medications in there very quickly because I feel like that's something important to go over. I did like, however, that it was listed room up at the top multiple times here. So for the perioperative setting that I was in, I put down room in pre-procedure, which room, and then room transferred to waiting, and then room transferred into OR room, and then transferred into the PACU. So you could see the different levels of care that was going through. So that was helpful for me. And then a question that I had was, how can you utilize leadership behaviors in your future practice? And I said, as a future OR nurse, I will use leadership behaviors by communicating clearly, staying organized, and advocating for patient safety. Strong leadership in the OR means giving accurate handoff reports, speaking up if something seems unsafe, or even if you want to review medications and you realize that that's missing off of someone's report, and helping the surgical team work smoothly together. I will stay calm during stressful situations, work respectfully with anesthesia, surgeons, and the scrub techs, and take responsibility for my actions and documentation. I also plan to keep learning new skills and staying updated on the operating room's best practices. By using these leadership behaviors, I can support safe surgeries, stronger teamwork, and the best possible outcomes for my patients. Thank you.